So the next topic is apoptosis versus necrosis. The apoptosis and the necrosis, these are the two different types of the cell death. So apoptosis, it is often defined as programmed and coordinated cell death. So that can occur in the various physiological and pathological signals. Whereas necrosis, it is an uncontrolled and accidental form of cell death that occurs due to the external factors like the physical injury, toxin, lack of oxygen, or the infection. So the necrosis, there will be degradation of the tissues by the hydrolytic enzyme. So the apoptosis, it involves a series of cellular events that leads to fragmentation of the cells into the apoptotic bodies that are engulfed and removed by neighboring cells without causing inflammatory reaction. So most important point is in apoptosis there will be no inflammatory reaction. So in this apoptosis, the cell death where the cells activate enzymes to break down their own nuclear DNA. Fragments break off, giving a falling off appearance. The cell's outer membrane, it remains intact, but it is changed to attract the phagocytes that remove the dead cells and the fragments. So this happens quickly. So that is why there is no inflammation. Unless apoptosis, the necrosis, does not involve the breakdown of the cellular component. Instead, the inflammatory reaction is always present. In apoptosis, there is death of single cells, whereas necrosis, there is death of many adjacent cells. The necrotic cells, they swell initially. They ruptures and release their content, including the enzymes and other molecules that can damage the surrounding cells. Whereas the apoptosis, it is characterized by cell shrinkage, chromatin condensation, and cell membrane blebbing. So cytoplasmic blebs on the membrane disruption occurs. In apoptosis, there is formation of apoptotic bodies, chromatin condensation, etc. Whereas in necrosis, there is damaged organelles, nuclear disruption, it occurs. In necrosis, there is lysosomal breakdown with liberation of the hydrolytic enzymes. Whereas in apoptosis, you will see the organelles, lysosomes and other organelles will remain intact, and there will be activation of caspases pathway. So this is the feature of the necrosis and apoptosis. Remember, in the cell size is there is enlarged in necrosis, whereas in apoptosis there is shrinkage. The nucleus undergo changes like pycnosis, karyolysis, and in apoptosis there is fragmentation into nucleosome size fragments. The plasma membrane is disrupted, whereas in apoptosis it is intact. So remember all these features and differences between the necrosis and apoptosis. The pycnosis, karyolysis we have discussed earlier also. Now let us discuss main about the necrosis and its types. Necrosis and its type. There are the types of necrosis can be either coagulative necrosis, liquefactive necrosis, caseous necrosis, fat necrosis, or fibrinoid necrosis. Let us discuss them one by one. The first is the coagulative necrosis. The coagulative necrosis, it occurs, it is type of necrosis that results from the focal injury due to the sudden loss of blood, like ischemia. So which organs are most commonly affected? Heart, kidney, and spleen. So the area will appear pale, firm, and slightly swollen. Over the time, it will turn yellowish, softer, and shrunken. So on a microscope you would see a feature of, that is, tombstone appearance of the cells. Very important, that tombstone, this the coagulative necrosis, it retains the cell outline resembling a tombstone, although the cytoplasmic and the nuclear details, they are lost. So remember, for exam point of view, you have to just remember the coagulative necrosis, it is seen in infarcts of solid organ, except the brain. So it is seen in the infarcts of solid organs. So this one is the normal spleen and showing the coagulative necrosis with the spleen. So this type of necrosis will denature both the structural protein and enzyme. The other form is a liquefactive necrosis. So that is caused by ischemic injury due to the powerful enzymes breaking down the tissues. The example of it is brain, infarcts, and the abscess. So the affected area will turn soft with liquid center containing debris. So on microscope, you will see cystic space that holds dead cell debris and macrophages. The liquefactive necrosis, it appears in the bacterial or the fungal infection. So the dead cells, they are entirely broken down, converting the tissues into the liquid. Other type is the gangrenous necrosis. It can be of three types: wet gangrene, dry gangrene, or the gas gangrene. So gangrenous necrosis describe a limb, often the lower limb, that has lost its blood supply, and it experiences coagulative necrosis affecting the multiple tissue layers. So when the bacterial infection occur on the top of this, the coagulative necrosis can change due to its liquefactive action of the bacteria, and it can attract the leukocytes, and leading to what known as wet gangrene. So wet gangrene, it occurs in the naturally moist tissues and organ like mouth, bowel, cervix, vulva, and diabetic foot. It can also develop as bed sore in bedridden patient due to pressure on the sites. So remember, the wet gangrene, it occurs due to blocked venous flow to the blood that causes thrombosis or embolism. So the affected area would appear soft, swollen, rotten, especially in case of gangrene of bowel due to conditions like hernias, etc. Other is the dry gangrene. Dry gangrene starts in the distal part of the limb. Remember, it starts in D for dry, D for distal part of limb. It occurs due to the reduced blood flow. Example is thromboangiitis obliterans, that is Berger disease, Raynaud's disease, etc. So dry gangrene, it slowly spread upward until it reaches an area with adequate blood supply, forming a line of separation between the necrotic and the viable part. The affected part would appear dry, shrunken, and dark black due to the hemoglobin relieved from the left RBC reacting with hydrogen disulfide, forming a black pigment. So the wet gangrene is due to the venous obstruction, it is due to dry gangrene is due to arterial obstruction. Wet gangrene occurs in bowel, dry gangrene limbs. Wet gangrene there is moist, swollen, dark morphology, whereas in dry gangrene it appears dry, shrunken and black. There is no clear line of demarcation in wet gangrene. There is presence of line of demarcation. So remember all the differences between the wet gangrene and the dry gangrene. The another form is the gas gangrene. It is caused by gram-positive anaerobic bacteria. That is Clostridia, which are gram-positive anaerobic bacteria. So these bacteria will enter the tissue through open wound. So the Clostridium bacteria will produce toxin that would cause tissue necrosis, edema, and cause severe symptoms, like there will be formation of accumulation of gas bubbles within the tissues. So these tissues become dark, black, and emit a foul odor. The muscle fiber will undergo coagulative necrosis with liquefaction. The other necrosis is the caseous necrosis. It is a type of coagulative necrosis. It is seen in tuberculosis infection, and it is named for its cheese-like appearance. So, the caseous necrosis, the area will resemble a soft, granular, yellowish, dry cheese. So microscopically, this necrotic area will be structureless, eosinophilic, and contains the debris, granular debris, and the most important part is you will see the Langerhans giant cells surrounded by rim of lymphocytes. So there will be granulomatous inflammatory reaction with epithelioid cells, Langerhans cells, and rim of lymphocytes. The other type is the fat necrosis. The fat necrosis, remember, for MCQ point of view, it is seen in pancreas and breast. It is seen in pancreas and breast. So in pancreas, injured or inflamed tissue release enzyme, that is pancreatic lipase. So that will cause a necrosis. The fat necrosis break down the fat cells into glycerols and fatty acids, so giving cells a cloudy look. So fat necrosis, it is It is yellowish white, firm, with calcium soap making it chalky white. So under the microscope, these fat cells, necrosed cells, fat cells would appear cloudy appearance. The other is the fibrinoid necrosis. That is, there is presence of fibrin-like material. It is seen in conditions like autoimmune disease, hypertension-related arterioles, and peptic ulcers. Now let us come back to the apoptosis. Apoptosis, as we know, it is a form of cell death where the cell active enzymes break down their own nuclear DNA and protein. So this there will be the cell outer membrane remain intact, but it is changed to attract the phagocytes that removes the dead cells. So this all process occur very quickly. So that is why there is no inflammation. So concise and accurate deposition, description of apoptosis. First of all, there is cell shrinkage, there is chromatin condensation, budding apoptotic bodies, they are formed. These apoptotic bodies, they are phagocytized and there is no associated inflammation. So what does the process of apoptosis involves? The process of apoptosis, it involves number one, 4 stages. The first is the death signal. So this stage involves various signal or triggers that initiate the apoptosis process. That can come from 2 pathways. One is the external pathway and other is the internal pathway. Second is the execution. So in this stage, a series of molecular events occur, including the activation of the most important is the activation of caspases. So what are caspases? These are enzymes responsible for the cell degradation and cleavage of the cellular components. So this stage, the cell will undergo structural changes like chromatin condensation. There will be alteration in the cell membrane and a formation of apoptotic bodies. The third phase is engulfment. So apoptosis bodies, they are recognized and engulfed by the phagocytes such as macrophages without inducing inflammation. So this stage ensures the removal of the apoptotic cells and prevent the release of harmful cellular content. The last stage is degradation. So during this stage, the apoptotic bodies that has been dismantled and packed are further broken down, recycled by the phagocytes and ultimately contributing to the clearance of these apoptotic bodies without causing any inflammation. So these are the steps that are involved. Now let us discuss the mechanism of apoptosis. So number one, as we discussed earlier, that apoptosis, it happens when the enzyme, which enzymes? They are the caspases. So these caspases will cut protein. So what are these caspases? They are a group of proteases, enzymes that break down. These caspases will do what? They will break down protein. So with the unique ability to cleave target protein at specific amino acid sites. So this precise cleavage of protein by caspases, it is the central feature of apoptosis. So two types of, remember there are two types of proteins. One are the, remember, is the pro-apoptotic protein. And other is anti. One is pro and other is anti. The pro will promote the cell death. The pro will cause cell death. So the pro will cause cell death by triggering the release of cytochrome C. From the mitochondria. So that will activate the caspases, and they, which in turn would cause would cut the protein. So the example of pro-apoptotic proteins, remember, is back and back. Backs and bad. So remember, the mnemonic backs and back, they are bad. So they promote cell death. The anti-apoptotic will prevent the cell death. So example is BCL2. So remember, BCL2 is, it is good. Backs and back, they are bad, and BCL2 is good. So these are the anti-apoptotic proteins. They prevent the cell death. So they help maintain the cell survival by inhibiting the caspase activation and maintaining the integrity of the mitochondria. So a balance between the pro-apoptotic and anti-apoptotic proteins will determine whether the cell will survive or not. So this is the mechanism of apoptosis. Now coming to the pathway. So there are basically the two main pathway. One is the extrinsic pathway and the other is the intrinsic pathway. The extrinsic pathway is also known as death receptor. Whereas the intrinsic pathway, it is also known as mitochondrial pathway. Right? So let us discuss the intrinsic, that is mitochondrial pathway first. So when the cell, it will lose growth signals, damaged DNA, it will activate the protein like PH3. That will trigger backs and back. So these forms channel in mitochondria, allowing the proteins like cytochrome C to escape, activating the caspases, and that will cause, on other hand, the anti-apoptotic proteins like BCL2 will block the backs and back. Now the radiations, toxins, and hypoxia, these all can play a significant role in initiating the mitochondria pathway of apoptosis. So this, first of all, the mitochondria pathway of apoptosis, it is typically initiated when cell receives signals indicating loss of survival factors or conditions that threatens the cell health, like radiations, toxins, hypoxia. DNA damage or accumulation of misfolded proteins. So in response to these signals, there will be sensors. The sensors, they are activated. So these sensors, these are the member of BCL2 protein, especially BH3 protein. So the BH3 protein trigger the activation of two pro-apoptotic proteins, back and back. So these channels allow the release of proteins that are within the mitochondria, most commonly the cytochrome C. As we know that cytochrome C, it is a crucial component of mitochondria respiratory chain, involving in generating the ATP, cellular energy. So when it is relieved in cytosol, it plays a central role in apoptosis. So when cytochrome C, it binds to other molecules, it forms a complex that will activate the caspase 9 activation. So that is the initiator, one of the initiator caspases. So the activation of caspase 9 will initiate a cascade of events, and again it will cause activation of caspase 3. So these caspases, they are responsible for carrying out the dismantling of cells during apoptosis, cleaving various cellular proteins. So a balance between the pro-apoptotic and anti-apoptotic proteins determine whether the cell will undergo apoptosis or not. If the pro-apoptotic signals dominate, the backs and back, they will active and leads to cytochrome C release and apoptosis. And if the anti-apoptotic signals will prevail, the other pathway is the death receptor, that is the extrinsic pathway. So remember, the cells have special receptors on their surfaces like FAS and TNF. So these receptors are like switches that controls the cell survival. So when these receptors, they are turned on by signals like the FAS ligand or TNF, they start working. So turning on these receptors causes them to call for help. So they invite the adapter proteins to join the party. So these adapter proteins are like crew that helps set up the special machines. So after a crew of adapter proteins arrives, they get to work. So one of their main tasks is to activate a special enzyme, that is caspase 8. So think of caspase 8 as boss of this operation. So its job is crucial in starting the process of the apoptosis. So here is where the things get interesting. The caspase 8, our boss, does not just stop here. It can also activate other protein, that is BID. So you can think of BID as an important messenger. So this activation of BID, it is connecting the two pathway, the death receptor pathway and the intrinsic pathway. So the connection makes the signal for apoptosis even stronger, like turning up the volume of sound. So bit's job is to travel to the mitochondria, that are the powerhouse of cells, trigger the release of certain proteases like the cytochrome C. So these proteins are usually stored within cytoplasm, but bit signals them to come out of them. So once the cytochrome C and other apogenetic factor they are out in the cytoplasm, they sets a chain of reaction that will cause activation of downstream caspases. So these caspases are responsible for the cell death. So the bid it acts as a messenger that strengthens the signal for apoptosis by connecting the death receptor pathway to the mitochondrial pathway. So this ultimately results in release of key protein, the activation of caspases, and dismantling of the cell. Now last is the clearance of these apoptotic cells. So the apoptotic cells, it will send eat me signals that will attract the nearest phagocytes. So the phagocytosis process leaves no traces of dead cells, and therefore it causes a minimal inflammation. So this is how the apoptosis process occur. So the early cell death might involve apoptosis followed by necrosis as the condition worsen. So this was all about apoptosis and necrosis part.